I remember some cases early on in the United States, in Massachusetts, where there was very little knowledge in the pediatric healthcare community about how to treat children with high blood lead levels. And I especially remember two little boys. Now, I was in the public health department. I never met these children. But the two little boys were never treated. They had blood lead levels. Now we would put them in the hospital and they'd stay there for a week. But they walked around with blood lead levels, should be less than 5, on average about 60, or one of them average about 80 for the other, for years. And they did not come out of that without any impact. I mean, they've had significant impacts on their life as a result of that. Now that these children are in their mid-30s, and they've been to jail several times, and they didn't graduate from high school, and all the things that we say. And I just remember them, and I think about them a lot.
The first was 2 cases of patients with lead poisoning when I was a junior doctor in training, in which the diagnosis of lead poisoning was not immediately apparent. And these really illustrated the potential for lead to cause significant problems throughout the body in many different body systems, and the fact that the diagnosis can often be a difficult one to reach, and that there's a need for increasing awareness of lead as a clinical problem.
I will pick up a group of cases who come to me with abdominal pain. The symptoms are severe abdominal pain, constipation, or even they have been hospitalized for that. And there is a lot of investigations have been done, so much so that even they have undergone CT scans, colposcopies to rule out cancers. And finally, something strikes the doctor and he gets a blood lead level done.
In one instance, more or less at the same time as I am talking to you, there's a small 3 months young baby which was brought to me with convulsions. By the time we measured the blood lead level, the child was no more. It had convulsions. It had died in my arms. That I cannot forget. I had decided there might be millions of such children in developing countries because the child's parents were working with lead even before they got married. After they got married, lead from their environment, food, entered the pregnant lady. It went, there's no placental barrier. The child got enough lead. Soon after its birth, it had convulsions, neurological problem, but it died at the age of 3 months. This is one instance. Another instance of 65-year-old man. He was preparing food at home. He had a grinder at home. His grinder had lead. Lead from the grinder came into his food, and he suffered from lead poisoning. It was he got into renal failure. Eventually, end-stage renal disease, he died. These are the 2 extremes. In between this 2 age group, a lot of people are consuming traditional medicines, folk medicines, getting into lead poisoning. And unfortunately, we do not have in these countries, developing countries, centers to evaluate blood lead level. That is very much required. There is no way to find out how much lead is there in their blood.
In 2010, in Nigeria, there was massive lead poisoning in northern part of Nigeria, we call Zamfara State. It was huge. It attracted the attention of CDC. It attracted the attention of WHO. Some WHO staff and CDC staff were sent to Nigeria, and I remember I did a few things with them while they were here.
People in Zamfara State lost over 400 of their children to severe lead poisoning early on in the outbreak. And there's a cohort of children who survived that outbreak but have serious neurological and behavioural consequences. Plus, their background lead levels in Zamfara State are still quite high by international standards. So you've still got population level impact subclinically on a population that is already extremely disadvantaged and marginalised.
The case that stands out the most is it's a family of 3 generations that work with, they worked around the house with battery recycling. And adults, young adults and children had severe lead poisoning. Children required hospitalization, and even chelation treatment. And one of the things that I remember most was that the family, the young people and the children had no education at all because they felt that they weren't able to learn. And they were convinced that they had a genetical disease, but never thought that lead could be culprit.
The WHO guidelines provide evidence-based information on the diagnosis and management of lead poisoning. They provide guidance on the management of lead poisoning in different age groups and poisoning with different degrees of severity.
The new WHO guideline will be a handy tool for physicians who are practicing in the sub-Saharan Africa.
It contains expert opinions of the practitioners from different countries, different parts of the world. You know, the facilities and tools for management of lead poisoning, for diagnosing lead poison cases, so they are different. All of these have been considered in this guideline.
I think these WHO guidelines are really timely in producing evidence-based guidance to clinicians, public health bodies and policymakers to standardize the approach to this significant clinical issue.
The doctors who are treating the patients, they will have standard protocols from these guidelines, that how to treat, when to treat, and what antidotes should be given. So all that will be available in one place.
I think that the WHO guidelines will help stabilize the supply of the chelating agents. They're increasingly difficult to come by in the United States and in many other countries. And I'm hopeful that the countries will use the information on the chelating agents in the document to inform their decisions about which ones of these medications will be on their formularies.
Prevention is really important in lead poisoning, and I think we really need to stress that in those with a raised blood lead concentration, whilst treatment with medicines such as chelation therapy can be important, by far and away the most important aspect of management is identification and removal of the source of lead, and I think the guidelines get this across really well.
I think that these guidelines are very welcome for many a group of health professionals that are worried about lead poisoning, and also for those that are not aware that lead poisoning is a threat for children's and adult health.